I'm Jenni Bishop. I'm doing my physical assessment midterm video. Here we go. I'm like, hey Nova, I'm Jenni. I'm going to be doing your physical assessment today. I'm going to close this curtain for some privacy. I'm going to wash my hands. And alright, we're ready to go. Alright, I'm going to look at the skin on your face to make sure it's a good color. It's nice and pink, and the temperature is good. You don't have any moisture. It's good texture. You don't have any edema in your face. The turgor is good. No bruising, scars, lesions, or molds. Alright, so now I'm going to put on some gloves, and I'm going to palpate your head and your scalp. I'm going to look at make sure I don't have any lumps, bumps, anything like that need to be addressed. Alright, can you look down for me? Alright, I'm just going to look for your hair. Alright, I'm going to palpate your temporal arteries. Is there any tenderness there?
No.
Alright, so I'm going to palpate your lymph nodes on your face. I'm going to your pre-auricular, post-auricular, your occipital, your tonsillar, your submandibular, submental, interior cervical, posterior cervical, and your supraclavicular. Alright, now I'm going to feel for your cranial nerve 5. Can you clench your jaw for me? Alright. Alright. Got your eyes closed. Can you feel this?
Mm-hmm.
You feel this?
Yes.
You feel this?
Yes.
Alright. Oh, it's a. Can you smile? Alright. Can you frown? Raise your eyebrows. Puff your cheeks. Alright, and then can you poke your lips? Alright. And then I'm going to feel for your TMJ to make sure. Can you open your mouth for me? Alright. You're good there. I'm going to look at your eyes. I'm going to look at your conjunctiva, and that looks good. Your sclera is nice and white. Right. Alright, I'm going to palpate your sinuses, your frontal and maxillary, and then I'm going to percuss. Is there any tenderness there?
No.
No? Okay. I'm going to look at your ears. Just make sure that I would be using a device, and I would just be looking in her ears. Her ears looks good. There's no bumps or lumps on her ears. I would look in, and I would see that the tympanic membrane is gray, kind of pearly, and the cone of light in her left ear is going to be at 7, and then her right ear is going to be 5, and the right ear doesn't have anything wrong either. Alright. So, now I'm going to do the whisper test. I'm going to just kind of whisper and see if you can hear me, okay?
Okay.
Can you hear me?
Yes.
Can you hear me? Yes. Okay. Alrighty, so now I'm going to get you to check, I'm going to check your vision. I'm just going to see, can you read what's on the top line here?
A, C, D, F,
Alright, right here.
X, W, Z, N, P.
Alrighty. Alright, now I'm going to check your pupillary response. Your cranial nerve 3 is what it's called. So I'm going to get over here, and make sure that they're both, I'm shining the light in there, making sure that they're both reacting at the same time. Do it on this side. Alright. Now I'm gonna I want you to follow my pen. I want you to just go whichever way, don't move your head, just follow with your eyes, okay? Alright, now we're going to test for convergence. You just follow my pen as well. Alright, it's good. Alright, now we're going to, if you'll just open your mouth. Actually, before I do that, I'm going to test your peripheral vision. So, tell me when you see my hands, okay? So, okay? So, okay? So, okay? Alright, so now I'm going to look in your throat, and you'll just go ahead and open your mouth for me. Okay, looks good in there, your teeth look good. You can go ahead and stick out your tongue for me. Alright, that's good. So you've never had any problems with a deviated septum or anything like that? Okay, so now look in your nose. Everything looks good. Things clear. Alright, now I'm going to look at the skin and everything on your neck. Just kind of look, and the temperature and everything's good. Everything we looked for earlier in your face. You don't have any edema or bruising. No. I'm just going to palpate your trachea. Make sure it's midline, and it is. Now I'm going to get behind you, and I'm going to palpate your thyroid. Alright, can you swallow? Alright. Thank you. Alright, now I'm going to palpate your carotid arteries one at a time. So you don't pass out. Alright, that feels good. I'm going to listen with the bell of my stethoscope. Make sure you don't have any bruise. Okay, that's good. Alright, I'm going to test your range of motion for your head and neck. So if I could just get you to bend your head down like this. Okay, then if you'll look side to side for me. Alright, and can you look up? Alright, good job. Then if you'll go ahead and shrug your shoulders. Okay, now I'm going to press down, and if you'll shrug them against me. Okay. Alright, now I'm going to listen to your heart, okay? Using the diaphragm in my stethoscope. Alright. We're going to look and listen to the aortic, harmonic, herbs, tricuspid, and mitral. And that's your apical pulse. And I would listen for a full minute and report any changes in your rhythm or anything. Now listen, and then if you'll stand up for me, I'm going to listen to your heart. Same 5 points. Alright. Alright, you can sit back down. Now if you'll just lay down for me. I'm going to listen to your heart again with you laying down. I would inspect for any heaves or lifts when she lays down. Alright. Now I would raise the head of the bed to 30 degrees and check for jugular vein distension. Alright, you are raised up, so you don't have any distension there. Alright. Alright, you can go ahead and sit up. Alrighty, now I'm going to get behind you and I'm going to look at your chest or your back here. Alright, so we're checking for the same thing, the color, the temperature, and everything that we looked for earlier. If you'll just go ahead, I'm going to feel, make sure you're, take a deep breath for me. Alright, everything is good bilaterally. Don't have any deformities, everything's symmetrical. If you'll go ahead and say, can you say 99 for me?
99.
Okay. Now I'm going to listen. Take a deep breath. Alright. Now say 99 for me.
99.
Alright, now say E.
E.
Alright, and say 1, 2, 3.
1, 2, 3.
Okay. I'm going to come back to the front. Alright, now we're going to do the same thing on the front, okay? We're just looking at your skin. You don't have any abnormalities, no bruising. Temperature's good. Alright. Now I'm going to palpate for, can you say 99 again?
99.
Okay. And now can you just take a deep breath for me? Okay. That's good. Just going to listen to your lungs on the front. Alright, and then if I could get you to lay down one more time for me. Alright, I'll look at your abdomen and just make, color's good, temperature's good, no bruising, no abnormalities. So now I'm going to listen. I'm going to check all of your abdominal arteries just to make sure you don't have any bruise in those.
Mm-hmm.
Listen with the bell, not this. Okay, now I'm going to listen to your bowel sounds. I would listen for 5 minutes. If I don't hear anything, then start in the right quadrant and go around. Alright, normal. Normal and active. Right, then normal and active. Normal and active. Alright, now I'm going to percuss your abdomen. Alright, are you feeling any pain or anything? Okay. So now I'm going to go ahead and just palpate, just light palpate, just make sure I don't feel any masses or anything. Okay. Palpate for your liver. Don't feel anything. spleen. All right, and then if you can just sit back up for me. Got one more thing. Behind you, I'm going to test and make sure you don't have any tenderness in your kidneys, okay? Tell me if it's tender.
No.
Tender?
No.
All right. All right, thank you, Nova.
Thank you.
Everything checked out good.
Wonderful.